1,500 more of deaths have also been registered. Health officials, though, fear the number could be much higher, with many fatalities going unregistered. Well, hospitals are now buckling under the pressure with a shortage of oxygen supplies and beds. The spike comes as Indian authorities open vaccinations to all adults. There's also, though, a shortage of shots. Our correspondents bring you the latest from New Delhi.
Today, India has launched the vaccination drive for all its adult population above the age of 18, making 900 million Indians eligible for the jab. Here in one of New Delhi's private hospitals, young people have been coming in to get their shots, which they have to pay for.
It is very important this day because, the scenario outside is so bad. I've seen my relatives suffering from coronavirus, and those who got vaccinated have not suffered much.
I'm scared. Because of the pandemic, because of the people dying, because of the shortage of oxygen beds.
So far, India has vaccinated 150 million with a single shot and only 25 million people with both doses. That's less than 2% of the country. Many states have said they don't have enough stock to roll out the new phase of vaccination, including Delhi.
We have asked so many hospitals, but they have said that we don't have any stock till now, and we are waiting for the government to make the stock available.
अभी हमारे पास 18 से ऊपर वालों के 44 का कोई डोजेज नहीं है. 45 अबव डोजेज है हमारे पास, उनको लगा रहे हैं.
When India launched its first phase of vaccination 3 months ago, the Indian Prime Minister said India is not only self-reliant in producing enough vaccines, but it will also be exporting to the world. But what we saw at different hospitals today tells us a completely different story.
Well, for more on the COVID-19 situation in India, earlier I spoke to Dr. Ramanan Laxiraman in New Delhi. I asked him what's gone wrong with the country's fight against COVID-19.
Since the cases went down, I think people were lulled into a false sense of complacency, and also the messaging was that COVID was essentially done and dusted. The government had declared victory, and so COVID-compliant behavior essentially, came to an end, and the virus came right back. And what we're seeing is the consequences of letting down the guard, and it's absolutely devastating. The 400,000 cases is probably a gross underestimate, simply because testing is simply not available across many parts and very difficult to access, and so there's certainly far more cases than that. India is also a very big country, and I think people fail to appreciate just how big it is. Although India did well in a numbers sense in vaccination, as a percentage of the population, only about 1.7, 1.8% of the population has been fully vaccinated, not enough to make a dent on the viral dynamics. And therefore, India, at the current rate of vaccine production, will take a couple of years to cover 70% of the population, and that is simply not enough.